Hello, I'm Dr. Ankit Parakh and I'm a consultant in pediatric pulmonology, pediatric allergy and sleep medicine at Children's Chest Clinic, New Delhi. So in this video, we'll be talking about skin allergy, which is also commonly known as atopic eczema or atopic dermatitis. So what is atopic eczema or atopic dermatitis? Atopic eczema or dermatitis is a skin condition where the skin becomes very dry and the skin becomes very itchy. Now when this happens, the child would be scratching the skin very often, and that leads to a lot of inflammation in the skin, and the skin can become red or erythematous. Now if this cycle keeps going on, then obviously the skin will become more thick, which is also called as lichenification. Usually atopic dermatitis starts at a very early age group. Children can develop atopic dermatitis before 6 months of age as well. This atopic dermatitis usually has a chronic relapsing course, which means it can appear at some times and then this can disappear. It can appear in some weathers, like it is more in winters, and then again can disappear. Some children will have persistent symptoms, which means that their skin will be problematic at most times of the year. Now, which areas of the body are commonly associated with atopic dermatitis? So it depends on the age of the child. So very young children or infants, like 1 to 2 years of age, they would usually have atopic dermatitis on the face. So the face is involved, the back of the neck is usually involved. They will have involvement of the hands, and they will have involvement of the extensor surfaces, so which means on this part of the hands, on this part of the elbows, and similar part on the legs and the knees. They can also have lesions on the anterior part of the chest. Now children, when they become older, so typically in school age children, they will have more involvement of the flexure surfaces, which means they will have involvement more of this part of the arm on the cubital fossa on both sides. They will have involvement on the back of the knees. They will again have involvement of the neck, and they will also have some involvement of the wrist on this part and the ankles. And in adolescents and in older children and in adults, the involvement remains to the face, the neck and the hands. Now, how important is atopic dermatitis? Well, children who have regular features of atopic dermatitis, they remain very disturbed because they have a lot of itchy skin. And because of this itchy skin, they keep on scratching their skin, and that leads to a very poor quality of life. Now, in addition to this, children who have atopic dermatitis, they are prone to having infections in the form of bacterial infections and viral infections, and that leads to what is something known as eczema or atopic eczema flares. So during atopic eczema flares, the skin becomes more red. It is not as dry because it starts to ooze because of the associated infections. There can be formation of pus, crusting, and it can be painful as well. So children who have atopic dermatitis, they need to be managed properly so that they have a better quality of life. So in subsequent videos, we'll be talking about how to manage a child with atopic dermatitis. So for more information, you can log on to our website, Ankit.